Welcome to this very special live webinar by the Alphazita Holistic Fertility team this evening. It's the second of our webinar series, and as some of you will know, each month one of the specialists from the Alphazita team will be focusing on their topic of how we can support you through your fertility journey. So we're live on Zoom currently, and I believe that we are just joining a live Facebook as well. Are we live? I think we're live. Fantastic. So tonight is the turn of myself, Rosie Letts, and Dr. Tsakos. And I'm aware that some of you may not have been introduced to either of us yet, or indeed may not have been introduced to the whole concept of Alphazita. So before we really get into our topic, I wanted to do a brief introduction, and also then we'll just be waiting for all the different attendees to join us on Zoom and on Facebook as well. So Dr. Tsakos, do you want to start by introducing yourself and what you do, and also Alphazita as our sort of CEO and founder?
Oh, hello, everybody. It's my great pleasure to be live tonight and to host together with Rosie Letts this webinar. Thank you all for attending. And we have a lot of attendees from all over the world, and many of you I already know. So hi, and the ones I don't know, hi, I would love to meet you in person, either live or online. Now, basically the concept is that we're trying to bring a team of fertility specialists together. I've been a fertility doctor for over 20 years, and overall I've been practicing in the field for 28 years. Thankfully, in the last few years, I've just realized how important it is to bring this team together, because I felt that as a clinician, I've been failing my patients by not providing solutions to their problems. It's very simple as a doctor to say, you're overweight, go ahead and lose weight and come back when your BMI is below 30 so that I can treat you. But that's not enough. It's the equivalent to having somebody with sugar diabetes and saying, oh, go ahead, I can't treat you, but I can't give you a solution either. So I think it is our duty as doctors to address the importance of providing solutions, not just suggestions. We need to give solutions, and solid solution to the problem of nutrition and weight is a nutritionist. As far as we're concerned in Alphazita, a nutritionist should be a valid member of every team, of every medical team, and of course every fertility team. So the Alphazita concept is a blueprint in fertility care, as Dave Gibbon, our embryologist, has said recently in our retreat. And the blueprint means that we bring a team of specialists together, addressing all aspects of fertility issues and providing solutions to that. So there's medical, there's technical, there's scientific, there's nutritionists. We address the stress levels, and we give solutions by means of acupuncture, fertility massage, and fertility coaching. This is the concept of Alphazita. Alphazita is a coaching and training concept by which one could be prepared for their fertility journey, and then they can be prepared to make changes and optimize their fertility health, which will affect not only the outcome of treatment, but also the outcome of pregnancy and the outcome of the overall health benefit in the future. And this is our vision, and it is my great pleasure and honor to be together with Rosie Letts tonight. Rosie Letts is a pioneer in her field. She has developed amazing programs, both online and on site. She has this incredible, so much, Rosie, for taking me on board that. And I'm sure that all of you, all over the world, you could benefit not just from the webinar, but also from whatever is on offer, both online and on site afterwards.
Thank you so much, Dr. Tsakos. And it's such a refreshing approach, and I think it's such a new approach to many of us to really draw all the different really important aspects of a true holistic fertility team together, and like you say, to provide that support rather than just scientific kind of information. So my name's Rosie Letts. I'm a nutritional therapist and a functional medicine practitioner, and my role as part of the team really is to support you on your journey to becoming a parent by helping to lay down the best foundations for optimum fertility and then for a healthy, happy pregnancy as well. Now, sometimes this might mean helping women to lose weight so that they get down to their optimal BMI, but it means doing that in such a way that we don't compromise their nutrition and we don't leave them depleted in vital nutrients that are so important for fertility. It might also mean correcting nutrient deficiencies. It might mean supporting your digestion or your detoxification systems, and it often involves teaching you to eat in a way that relieves inflammation and creates a really nourishing environment for your eggs and your sperm. So tonight's topic is boosting your fertility with nutrition. And we thought that this was a really important topic, particularly at this time of year, because we are kind of over the next few weeks likely to be bombarded with chocolates and alcohol and treats and all sorts of sort of festivities, and it can be easy to feel like you're really being pulled in multiple directions. So we wanted to give you some really practical advice on how you can join in and enjoy yourself, but how you can do it in such a way that's not going to compromise your fertility. We'd really encourage you to submit questions. So our aim is to answer as many questions as possible. So please, if you're on Facebook, do submit questions in the comments. And if you're on Zoom, you can submit questions here as well.
Sorry, Rosie. We do have a question right now, if that's okay. And this is from Samina. And hi, my name is Samina. Can you give advice on PCOS and diet? Would you like to comment on that, please? And then obviously I can give my medical viewpoint, if that's okay.
Yes, it's a fantastic question. I was actually talking with the chair ladies of Verity, the PCOS charity, at the weekend at a fertility event, and there has just been published international guidelines on PCOS nutrition. So for the first time, it is now completely internationally recognized that nutrition is vital component of PCOS management. So weight loss is definitely an important part of controlling PCOS, but it really needs to be done in a specific way. So trying to control blood sugar levels, eating enough protein to make sure that your blood sugar levels are as controlled as possible, and trying to avoid insulin spikes are kind of critical components of a PCOS diet. There's a lot more information on the specifics in a free guide that I will give out in the end. Dr. Tsakos, did you want to add anything to that?
Sure. PCOS is a metabolic disease, and part of that equation is diet and nutrition. So we're in Greece, in the Mediterranean countries, the incidence of PCOS is very high. So all the countries like Spain, Italy, Greece, Turkey, especially in the south of these countries, PCOS is much higher than the average. So over the years, we've had amazing experience in treating those people. And what we know only too well is that it's a metabolic disease. So this disease is creating a vicious circle. So because of the disease, you put on weight easily, and because of the weight, the disease gets worse. So effectively, with a proper nutritionist-guided program, the majority of PCOS symptoms and problems could be cured. So effectively, you can stop having the syndrome by just following the nutritionist advice, which is long-term. Don't expect a miracle over the weekend or over a couple of weeks. It's a long-term coaching, but this coaching can last for a few weeks, a few months maybe, but then it's yours. It's all the experience is yours. How to treat, how to understand first your PCOS, and then to treat your own problem. So effectively, if the polycystic ovarian syndrome is managed by weight balancing and by weight coaching, more often than not, we don't need to interfere. It doesn't become a medical problem as well. I think polycystic ovaries is a very typical example where life changes by means of proper fertility coaching by the specialists can actually prevent the problem from becoming medicalized. So for us, this is very important. And this is an area we could dedicate webinars and weekends and sort of endless retreats just on polycystic ovaries. But I think the take-home message here is that, pick up the nutrition that suits you. And I'm sure that together you can cure PCOS. You can still have polycystic ovaries, but you will not have the syndrome if you understand it, if you're coached how to deal with it, and of course, if you manage your weight properly.
Yeah, I think I completely agree with everything you're saying there, Dr. Tsakos. I think part of the problem is that message isn't necessarily being shared as much as it should be. And certainly in the UK, we see that PCOS is treated with medicine, and often women really aren't told about the benefits of their diet. So hopefully that's really starting to change. And that was the conversation that we were having over the weekend.
Sure, and if I can comment shortly, and the reason why is that it's very easy to say, okay, go on the pill, and then it's like covering with makeup the problem on the face. We're not curing the problem, we're just covering it. So it's much easier for doctors. I mean, for us, doctors are busy people, and we treat people very quickly. Unfortunately, this is not the right way. We don't have time. GPs, they have 10 minutes per patient. One patient, one problem, 10 minutes. So it's much easier to say, go on the pill if you don't want to get pregnant, or start clomiphene if you want to get pregnant. If you want to properly educate them, of course, you need more time and you need more expertise. I mean, us doctors, we know what they need to do, but we don't know how to apply it. So I think this is the reason why it's becoming a phenomenal problem, because we don't really address it properly. And it can be very simple. It can be very simply treated. I mean, we see polycystic ovarian syndrome young girls in their early 20s. I mean, they have 20 or 30 years ahead of them with trouble, which they can avoid if they're coached properly by the proper people.
And it's becoming more and more of a problem. I think we're up to 1 in 5 now women in the West with PCOS, which is just incredible, to be honest.
Sure. And if I can make one final comment on this, I'm sorry, Rosie, but I'm quite passionate about that. I mean,
sure.
We have PCOS in our family. I mean, just to make it simple for you, very close family members of mine have polycystic ovaries. So, and most of our patients, I mean, 1/3 of our patients in our clinic in Greece, they do suffer from PCOS, which is combined with, of course, obesity and metabolic problems. It's not just conception. It's not just appearance. It's not just irregular periods. It's problems with pregnancy. It's massive complications in pregnancy, impaired glucose diabetes conditions in pregnancy. It's complications in delivery, and it's even complications in later life. So it is very important to address that and manage that. And the best doctor could be yourself, provided that you've been coached properly.
Great. Dr. Tsakos, we couldn't talk about nutrition and fertility without talking about BMI and weight. It must be one of the most common problems that you come up against. Can you explain from a medical perspective whether BMI is actually that important and why that is?
Of course it is important. I mean, what is not known is what is the cutoff. I mean, obviously in the UK, the cutoff for treating patients is a BMI of 30, which is quite arbitrary. I'm not sure it's the same. I mean, of course, as you know even better, it has to do with, how this BMI is actually monitored and how we're sure it is. Is it fat or is it muscle and so forth? And okay, we don't treat over 30, and what about 30.5? And what about 29.8? So is 29.8 safer than 30.5? So this is definitely arbitrary, and this is just an excuse, if you like, to push the problem to the side and say to someone, okay, you have BMI of 31, we can't treat you, go and lose weight and come back, which is not the right way to approach it. Why is it important? Because it increases the complications of fertility treatment. It increases the complexity. I mean, a simple example is that, we need different doses of drugs for somebody who's BMI of 30 than someone who's BMI of 25, because drug stimulants for the ovaries is dependent on the weight. And of course, everything is more difficult. Even scanning is more difficult. Accessing the ovaries is more difficult. Diagnosing that the uterus or the ovaries are normal is difficult. And of course, the egg collection itself is difficult. If we give sedation, it can be complicated. So we're talking about a more difficult case. even embryo transfer can be difficult because sometimes it is not easy to access the cervix in order to implant the embryos. And of course, pregnancy is difficult, and the complications of pregnancy are even more difficult, and delivery. So there's a lot of reasons why BMI has to be looked at, but we should not be racists with our obese patients or with our overweight patients. And I honestly feel that we have been racists, and we have to change that. We have to give them support. It's not enough to say you're not eligible either for NHS treatment or for private treatment because you're spoiling our statistics, because you're a difficult case. We have to support, and we have to provide specific solutions.
Yeah, so in the UK, we often hear that women are told you're not eligible, you need to get your BMI under 30 and then come back for treatment. And so they're given options of popular diet models to follow. So typically Slimming World and Weight Watchers. And that sounds sensible on the surface, but I have some issues with this. And the first really big issue is that diets don't work. And all the research shows that diets don't work. Diet defined as a restrictive way of eating for the purpose of losing weight. Statistics show that 95% of people who diet will put the weight back on within 1 to 5 years. So fertility journeys can be long. It's just not a very sensible approach. And it doesn't take into account the psychology of weight loss. And I think that's a huge thing is, women who are overweight for a reason. Maybe there's been trauma, maybe there's been abuse, maybe there's a hormone imbalance, and just dieting won't fix that problem. We need to get to the root, and I guess that's also where our fertility coaching comes in to address trauma, and nutritional therapy and medical approaches to actually understand what's going on at a chemical level so that we can correct that.
Can I interrupt for a minute? We have a very interesting question on Zoom, and I would like Rosie Letts to answer this question if possible. Good evening. Can sperm motility be improved with nutrition? And what about sperm quality in general? Thank you. Introduction, very short. We should not forget our men. Men are 50% partners in that business, so we should not forget you. So diet and nutrition is affecting yourselves as well, and in a lot of ways. With regards to sperm quality affected by nutrition and by other factors, may I stress that it is very important. Of course it is. Of course it is affected by smoking, by alcohol, by being overweight, by the pollution in the atmosphere and so forth. I mean, currently there is a huge piece of research being conducted in Europe where sperm is being checked to see, it's the most sensitive marker, if you like, of pollution and so forth. So of course it is affected. So please, Rosie, please explain to our attendee and to our audience how can sperm be improved with nutrition, and how generally the sperm quality can improve with nutrition and diet.
Great, yeah, thank you. So, I mean, the number one source of pollution is coming from our diets, and unfortunately, the food that we're eating now tends to have more contaminants and less nutrition than it ever did before. And so, really working on the quality of one's diet is key here. A few areas to look at would be fatty acids profiles. So, most of us don't have anything like enough omega-3 fats in our diets, and far too much omega-6 fats. So those are coming from kind of processed meats and processed vegetable oils, etc., and not enough oily fish. And that can really affect sperm motility. Also, we have to understand simple things like dehydration, deficiencies like zinc, like selenium. These are things that aren't typically tested for at all, and very often we find that in men with low sperm motility and poor sperm quality, they're very heavily reduced. There's also been a lot of research around vitamin D. It's probably one of the most researched topics at the moment, showing that reduced vitamin D levels will have a huge impact. And if you're living in the UK or in a European country and you haven't been away and you haven't got a nice suntan, it's very likely that you are going to have a deficiency. So all really important areas to look at. But also, stress and exercise, I'd say probably equally as important, wouldn't you agree, for sperm quality?
Sure, absolutely. And if I can ask you to comment a little bit about the micronutrients, Rosie, how do you think nutrients affect sperm quality, and whether men should go on that, either to improve a suboptimal sperm count or to maximize the chances of pregnancy?
Yeah, I guess it's really important to understand what the micronutrient deficiencies might be. And so what I'm not keen on is people just taking supplements because they feel like they should. And actually, Gordana, our acupuncturist, and I were commenting when we were at the fertility show, every time we go to one of these events, there are more and more supplements that people should be taking. And that's become a bit of a kind of craze. But absolutely, a really good quality multi-vitamin, multi-mineral supplement, and making sure that the quality of your food is, as organic, as fresh as possible. That's the best way to optimize your micronutrient consumption and therefore optimize your levels.
Sure, I couldn't agree more, Rosie. I mean, supplements is the quick fix. I mean, people think, okay, I'll buy the most expensive one from whatever, the Boots, and then I should be fine, and then I can carry on drinking, eating, not exercising, and eating carbohydrates every day. So yeah, absolutely, there's no quick fix. And again, this has got to be communicated with our patients, with our clients, with all the fertility patients, and correctly. It has to be communicated. On the other hand, if specific tests show specific deficiencies, then of course that has to be corrected in a way. Now, there's a new science now being developed, which is called precision medicine. We're not going to talk about it, but I know it's Rosie Lett's passion and vision. Precision medicine is actually measuring very specifically with very specific, highly sophisticated tests. We can measure the metabolites, we can measure the end products of the metabolism of each person in order to optimize specifically their needs on micronutrients or vitamins and all that. So there's no quick fix, there's no magic. The boxes, they may look very attractive and they're very, very charming, and we feel very well when we pay, tens of pounds to buy a month's worth of supplements, but they don't always work, and usually they don't work on their own. A second comment for 30 seconds, if I may, is that especially Mediterranean men, but overall men in total, they don't like to accept that there is a problem with the sperm count. And they don't like to be the reason why they proceed with IVF. As we all know, 40%, possibly 40 to 50% of couples, the problem is actually the sperm motility or quality overall. And there is a resistance to accept that. So by all means, yes, you can take a little bit of supplements, or you can improve lifestyle and all that if you want to optimize your sperm quality. However, if this is extremely low, please do not hesitate to move forward with IVF. So if you have a very low sperm count, under 10 million or under 5 million, please do not expect miracles, because miracles do not happen.
We have a couple of questions on Facebook which are related to acupuncture. So it would be a good time to mention that next month, Gordana, our acupuncturist, will be hosting a live webinar with Dr. Tsakos, and she really is the person to be answering questions related to acupuncture. So everyone should definitely try and sign up for the next webinar in our series and get that time with Gordana. Dr. Tsakos, I wanted to talk about support. Now, I met a lovely lady at a fertility event in Wales this weekend, and we were talking about her nutrition. She needed to lose a considerable amount of weight on the advice of her consultant. And she said to me quite guiltily, I've read Zita West's book, and so I understand the theory, I just don't do it. And there was this clear implication that this was obviously her fault. And I wanted to give her a hug and say, of course you don't do it, because the science hasn't been translated for you into practical applications that fit your lifestyle. And I think so often, we just kind of offhand give these remarks, lose some weight, come back, and we're not taking into account that, you know, many women have dieted for most of their lives, literally, and if they could have easily lost the weight, they would have done it by now. So, you know, I see that as quite a big problem, that there just isn't this follow-up support. Is our connection okay?
Yeah, absolutely fine.
Okay. So why is it that more IVF clinics don't work with nutritional therapists and coaches and people who can offer this level of support to their patients?
Well, the easy answer is that it's not easy because there aren't that many qualified nutritionists around, and the ones who are well established, they work on their own, and of course they wouldn't have the time or the commitment to dedicate on fertility alone. So, you know, we have to face it that it's not, you know, you don't find a top nutritionist very easily, so they're not available. On the other hand, IV clinics, they do have, you know, big teams anyway. They have scientists, they invest on science, on nurses, midwives, doctors, anesthetists, more scientists, geneticists, and all that. So it isn't easy to build a team. So perhaps that's one of the reasons. But perhaps we are a problem as well as doctors, because we haven't stressed enough the importance of the nutritionist and the importance of proper coaching, which is long term. And it's also coaching and education for the staff to understand the role of the nutritionist. So every medic is trying to be like an amateur nutritionist in our own right, which is not right, of course.
Yeah, we met one of the wonderful couples on our last retreat, fertility retreats that we host at Sani Resort in Greece in October, was saying that they've been on their fertility journey for many years, and she needed to lose some weight, and they'd lost some weight through Weight Watchers. But actually, talking to us at the event, it was the first time that they'd understood that the dieting that they had done could potentially have really negatively affected their fertility, because they've been having low-fat products and skipping meals and doing shakes and kind of all of these practices that are not going to optimize egg quality and sperm quality and create the most nourishing environment. So obviously the research is there, but the information isn't necessarily reaching our patients.
Sure. Can I go through the question and answer list again, if I may? So there's two questions on acupuncture: whether they would improve women with PCOS trying to get pregnant, and how often should we go, and how do we find a practitioner who can specifically treat PCOS for fertility? I mean, essentially, please ask your doctor, please show them that you would like to explore the acupuncture avenue, and then it would be very interesting for your doctor to liaise with an acupuncture specialist who specializes a little bit more in fertility. And of course, as Rosie Letts mentioned, there's going to be like a specific webinar next month, I think, on acupuncture, and then perhaps our in-house acupuncturist, Gordana Petrovic from London. She should be able to answer the questions. So there's one more question, which is quite complex. So it says whether and how it improves, how nutrition improves survival and quality overall of embryos and sperms. And the answer is very simple, is what we've said already, that in more ways than one. Firstly, then improving the environment in which sperms and eggs grow, but also improving the overall access to the eggs in terms of managing an overweight woman, and of course the behavior of the sperm, motility, and the overall antioxidant level, and so forth. So definitely it does improve that. We have our embryologist Dave Gibbon, who would be the most specialized person to answer that, and hopefully one of our webinars will be more specific onto the embryologist's perspective of how nutrition actually improves what they see in the lab, the sperm and egg quality, and ultimately embryo quality.
Fantastic. So we're heading straight into the Christmas period, and I understand that this is a really, really difficult time for anyone who is trying to look after their nutrition, but also it can be a really, really difficult time for people on their fertility journey in general. So I wanted to sort of share some advice on how to enjoy the festive period without sacrificing your efforts and without kind of doing yourself any harm as well. So the first thing, I always like to give really, really easy to apply advice. So we'll start with the basics. Remember to drink enough water. I think it's so easy when you're rushing around and you're shopping and you're cooking and you're wrapping presents, etc., to forget. When you're dehydrated, the cervical mucus is thicker, and quite simply, it's much more difficult for the sperm to travel. So it sounds simple, but making sure that you're really, really well hydrated is going to make it much, much more easy for sperm to travel through the cervical mucus. Also, for weight loss, you know, if you are trying to lose some weight over a period of time, making sure you're well hydrated is crucial, because if you allow yourself to get dehydrated, you're much more likely to get hunger pangs and want to end up eating rather than drinking. So it's really easy to confuse hunger with thirst. Sorry, questions coming through on the Facebook, and I'm getting distracted by them. I apologise. The second thing, and this really relates to the question on polycystic ovary syndrome as well, making sure that you have good healthy snacks with you and available all the time. So one of the things, when you're trying to control insulin levels and not let your blood sugar levels spike, it's really important that you eat small quantities of good quality food frequently. So having things like olives and vegetable crudités and nice dips around is going to keep your blood sugar levels balanced, and it's going to stop you from being drawn to the less healthy sort of treats and things as well.
Sure. Can I run through this question? Do you feel that a vegan diet is okay for fertility? I think you should be answering this, Rosie.
We were talking about this one on the retreat as well. Yeah, absolutely. The thing with vegan diets is most people choose to eat vegan because of ethical reasons rather than for health reasons. And so you understand that there are some compromises. If you're following a vegan diet, you will need to take supplements. It's really important to understand that. And it's also really important to create a proper meal plan. So what I always advise, I've got a template on my website that you can use, is to write down what you eat in a week, write down what you ate last week, and then it will clearly show you, you know, whether you're getting enough protein, whether you're getting enough fat-soluble vitamins, which are often kind of quite devoid in vegan diets, whether there are enough B vitamins, etc. And there are supplements that you will need to take. So omega-3 is one of the most important supplements for fertility anyway, as I briefly touched on last time, and one of the only sources of omega-3 in the natural world is from oily fish. So the only way that we can really get that for vegans is from algae, so algae supplements, and obviously that's where the fish get their omega-3, so you can do it. It depends how long you've been vegan as well. If you've been vegan for quite some time, then I'd say it's highly likely that there are some nutrient deficiencies. So, and again, you can test for those, and these are simple tests that you can do at home: urine tests, blood spot tests, etc.
Sure. If I can summarize then, the way I understand it, Rosie, is that a vegan diet is fine as long as you understand what you're doing, why you're doing it, and what specific supplements, either via food or via added supplements, you should be taking. And of course, you would need specific coaching as well, because this is the case in which a proper nutritionist specializing on fertility would be very vital to guide you through getting the best out of your vegan diet. So vegan diet, yes, but with full understanding of what you should be doing and what you should be taking if you are aiming for fertility. Now, there's one very technical question, which I'm afraid we can't answer now live. Anything that can help implantation? I've had 4 failed implantations. Everything seems to be perfect. And what can I do? But can I offer to this attendee, please, can I offer them one-to-one free consultation if they wish? So please get in touch after the webinar, and I will get together with our team to be able to address your complex issue and hopefully give you some solutions. Thank you. Last one. Yeah. Can you run through the last one, please, Rosie?
I can't see them, sorry. Where?
Can thyroid problems affect fertility? I had half of my thyroid removed, and since then I always feel cold and tired. That probably means that you're deficient in a way. You can start by checking very simple things. It's only 5 hormones that we would like you to check, starting with the TSH, T3, T4, and the antibodies. And of course, depending on the results, you may or may not need a thyroid scan to see what's going on. So this is an endocrine problem that can affect your general health, well-being, as well as your fertility. So please have those tests if you like, and then take it from there, either with your fertility specialist or with your general practitioner.
With thyroid tests, comprehensive thyroid tests, your GP is unlikely to run those, but you can use MediChecks, or there are other online companies that do that. I think they're about £60, so it's not an expensive test. And then, you know, combination of nutritional and medical approaches hopefully will be really effective. But yes, absolutely, thyroid will affect fertility.
Sure. Rosie, we only have 10 more minutes. Would you please give to all of us some tips for the holiday season? So focusing on fertility, but of course we'll be listening very carefully to get some tips for ourselves.
Yeah, absolutely. Actually, it's a good time to say that because nutrition is such a huge topic, I won't be able to run through everything. But after the webinar, I will send a link to my free Fertile Body Guide, and I'd really encourage you to have a really good look through that later, because it will provide lots more advice. So for the holiday season, we've already said make sure you're drinking plenty of water and make sure you've got good quality snacks available at all times. Lots of questions about micronutrients and antioxidants. The best place to get these is from vegetables, and I think that Christmas and the holiday season is a perfect time to indulge in lots and lots of vegetables, because most of us have got a bit more time for food preparation, etc. Actually, when you think of, you know, the classic Christmas lunch, it's a really healthy meal as long as you're getting your proportions right. So every main meal, I'd encourage you to try and have half your plate vegetables, and if you're doing that, and if you're getting a really nice variety of vegetables of all different colors, then you are getting as many antioxidants and different micronutrients as possible in there. Making sure that you have some treats available. Denial is a terrible idea, and it's a particularly terrible idea in winter, and also when everyone else is having fun. So make sure that you're stocking up on good quality, nutrient dense treats so that you don't feel left out. So we're spoilt for choice now. Any good health food shop, places like Ocado, will have a really good range of, you know, low refined sugar, really good quality chocolates and ice creams and desserts, etc. So make sure you've got plenty of those on hand. And we couldn't talk about the holiday season without touching on alcohol, which is obviously a big topic. Dr. Tsakos, I mean, I wouldn't like to abstain completely. My advice would always be to just kind of plan your nights out and make sure you know what is an acceptable limit for you. Make sure you're having non-alcoholic drinks between your alcoholic drinks, and making sure you're choosing clean alcohol, so good quality wine, clean spirits with good quality mixers, etc. That would be my advice. So you can take that as a okay to have the odd drink over Christmas.
Sure. We're just 5 minutes from closing. There's one question about reflexology and aromatherapy. We can't answer this question at the moment, but please stay tuned. And as an Alphazita team, we are developing an approach towards those subjects. So please stay tuned with Alphazita. I know that most of the members of the teams, they have very good contacts with reflexologists and aromatherapists, but at the moment as a team, we don't have a solid answer to how that helps and what is the evidence behind it. So thank you so much for asking. Before we close, I would like to thank everybody for listening. I understand that Rosie Letts has a couple of offers to make. So please, Rosie.
Absolutely. So the first will be my Fertile Body Guide, which is a PDF ebook. It's got tons of information in there, and it kind of works you through the kind of pinnacles of a truly nourishing fertility diet, and how to apply that so that you're not having to radically change everything. So that's available free to everyone who's watched tonight. We'll send it out with the recording. Dr. Tsakos also has a fantastic offer. He's agreed to give 2 attendees a complimentary Skype consultation, medical consultation. I know that those will go really, really quickly. So is the best way to claim those to just send an email after the event?
Yes, absolutely. And I would definitely be very happy to advise that attendee with the multiple implantation failures. And also, let's mention that next month we're having another interesting webinar, I hope. I'm not exactly supposed to be mentioning who is going to be speaking and what is it going to be about. So please stay tuned with the Alphazita team. And also in March in London, there's going to be a retreat, which is going to be like a day event. And again, please stay tuned with Alphazita, and details will be posted soon.
Yes, it's a fantastic opportunity to come and meet the whole team. It's almost impossible to get everyone on a webinar, but for the London event, we will all be there and we'll be offering mini consultations throughout the day. So a great way to meet everybody. Thank you so much for attending, everyone. I know that we probably haven't managed to answer all your questions, but I'm really happy to continue answer questions after the event. If you want to submit them by email, we'll make sure that they're all covered.
Thank you, everyone. Thank you, Rosie. It's been amazing being live on Facebook and on Zoom tonight. And have a good evening. I hope to see you very soon.
Have a good evening.